Podcast 15, Week 17. Welcome to the podcast, Your Pregnancy Week by Week. This podcast covers the 40 weeks of pregnancy in 38 segments and is based on the book Your Pregnancy Week by Week by Dr. Glade Curtis, MD, and me, Judith Schuler, MS. The information in our books and podcasts is a general informative guide about pregnancy. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctor. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your pregnancy concerns, questions, or interests into words. The goal of every pregnancy is a healthy mom and a healthy baby. To that end, our podcasts cover many topics. In each weekly podcast, we'll highlight information contained in the same weekly discussion in our book. We suggest you read each weekly chapter to learn further information, such as how baby is growing and changing and how you're growing and changing too. Our book also contains illustrations of changes in baby or you, advice for dads, charts, lists, boxes, an exercise for every week, a comprehensive glossary, hints, tips, snippets, and blurbs we just can't reproduce in a podcast. So let's get started on this week's discussion. We're going to look at week 17. Are you having occasional pain on one or both sides of your tummy? Is it a little worse on one side than the other? You're probably experiencing round ligament pain, a sharp, jabbing pain on one or both sides of the tummy or in the hip area. It often occurs around this time. Round ligaments attach to each side of the upper uterus and to the pelvic side wall. When the uterus gets bigger, these ligaments stretch and pull, which may cause pain or discomfort. The pain doesn't hurt baby. Talk to your doctor if pain is severe or if other symptoms arise. Warning signs of serious problems include bleeding, loss of fluid from the vagina, or severe pain. Another common complaint is leg cramps. They really can be a pain. To help deal with them, don't stand for long periods. Rest on your side as often as possible. The left side is best. Do stretching exercises on your legs and feet. Eat raisins and bananas for potassium. Get 1,200 milligrams of calcium a day and drink lots of water. You may have ultrasound during this second trimester. It may be ordered if you have any bleeding. Your doctor may also want to check to see how baby is growing. It may be used if you're carrying more than one baby, and it's always used with amniocentesis and chorionic villus sampling. Your doctor may order a 3-dimensional ultrasound if he or she wants to look for a problem or rule out a birth defect. 3D testing helps assess babies with facial problems, hand and foot problems, spine problems, and neural tube defects. During pregnancy, it's normal to have an increased vaginal discharge called leukorrhea. It's not an infection. We believe it's caused by increased blood flow to the skin and muscles around the vagina. If you do have a discharge that's foul-smelling, yellow or green, and causes itching and irritation, it may be a vaginal infection. If you have symptoms, call your doctor. Many creams and antibiotics are safe to use during pregnancy. Are you a vegetarian? Vegetarians often eat a more nutrient-rich variety of foods and include more fruits and vegetables in their food plans. During pregnancy, choose fresh foods for the vitamins and minerals you need. Eat enough different sources of plant protein to provide energy for you and baby. You should be able to get the vitamins and minerals you need. If you don't drink milk or include milk products in your diet, add other sources of vitamins and minerals, especially calcium. Be sure to get omega-3 fatty acid. You can find it in foods that contain linolenic oil, a type of omega-3 fatty acid. Vegetarians and pregnant women who can't eat meat may have a harder time getting enough vitamin E. Vegetarians also are more likely to have a zinc deficiency, so pay close attention to getting enough of these vitamins and minerals. If you eat a vegetarian diet, let your doctor know. You may need supplements. You may also want to see a dietitian. He or she can give you advice and pointers on ways to get the best nutrition for you and your growing baby. The quad screen test is the same as the triple screen test with the addition of a fourth measurement. This increases the detection rate of Down syndrome and lowers the false positive rate. The test checks your blood and adds many factors. Test results can help your doctor determine if baby may be at higher risk for certain birth defects. Are you into complementary or alternative medicine techniques? These refer to treatments and products not considered part of traditional medicine. Most doctors don't learn about these techniques during training, nor do they use them in practice. Complementary medical techniques are used with traditional medicine. When used in place of traditional medicine, they're called alternative medicine. Complementary and alternative medicine techniques include homeopathy, chiropractic, the Alexander technique, energy healing, acupuncture and acupressure, biofeedback, guided imagery, Chinese medicine, therapeutic touch, reflexology, massage therapy, meditation, yoga, and aromatherapy. Be sure to talk to your doctor about any of these treatments before you use them. Some may be beneficial, but it's always best to get your doctor's okay. Have you heard about doulas? A doula is a woman who is trained to provide support and assistance during labor and delivery. Doulas don't deliver babies, replace a doctor or midwife, play the role of a nurse, or replace the labor coach. They perform other duties such as providing continuous care during labor. They also help relieve pain with massage, breathing techniques, and water therapy. In some cases, a doula can support and guide a partner during labor and delivery. Usually, doulas work with women who have chosen a drug-free labor and delivery. If you've already decided you want anesthesia, a doula may not be the right choice for you. If you and your partner choose to have a doula, talk to your doctor soon. He or she may find her presence intrusive and veto the idea, or the doctor may be able to give you the name of someone he or she often works with. Start your search now. If you wait, choices may be limited. DoulaNetwork.com can help you find doulas in your area. There are also postpartum doulas to help women and their families ease into parenthood. A postpartum doula's services are most often used in the 2 to 4 weeks after birth, but support can last anywhere from 1 or 2 visits to visits for 3 months or longer. Some doulas work evenings and/or overnight. If you think you may want a postpartum doula, make arrangements a few months before your due date to be sure of her availability. Remember, our podcasts give you the highlights of what may be happening in any given week. Check our book, Your Pregnancy Week by Week, for more detailed information. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. It covers pregnancy from a man's point of view and provides lots of valuable information a man may find very useful. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It details topics covered in each podcast, so you can listen to a particular podcast or read a certain chapter week if you want more information, or if you want to check out something you missed or a topic we haven't covered yet.